us when they're asking us for answers, and we have to say, I don't really know why this is going on, or I don't know where this is coming from. But yet, that's a principle in one of the pledges. Why is it so important that we do that, and how do we remedy that?
Yeah, it's interesting. So it's an actual pledge in the Hippocratic Oath. It says something like, "I shall not be afraid to say I know not." And when you think about it, you can understand why doctors don't want to do that. When somebody comes along and says, what's causing my back pain? What's wrong with me? Nobody, whether it's a physio or chiro or anyone, nobody wants to say, I don't know. I don't know what's wrong with your back, I'm pretty sure you're going to be fine. And so we make stuff up, and so it depends on who you see as to what diagnosis you get. But you always come out with a diagnosis. The chiropractor will always say, that there's something wrong with the alignment, and here it is, and I'll show you here. And the physios will be more, muscle based, and the orthopedic surgeon will talk about the discs and the, bone spurs or whatever. We all just sort of throw a label at it because we feel uncomfortable saying, look, I don't know what's causing your pain, but I do know that it's not anything serious. And people with your type of back pain normally get better, and do that. It's difficult. It's easier just to give it a label, and it doesn't matter. It doesn't have to be musculoskeletal, anything. There's been some interesting studies where they got actors to be patients and go to different specialists with vague complaints. Just feeling generally, not that great, and depending on who they saw, they got these different labels. So if you saw a rheumatologist, you got diagnosed with fibromyalgia. If you saw a gastroenterologist, you got diagnosed with irritable bowel syndrome. If you saw a neurologist, you got diagnosed with migraine. And if you saw, whatever, a psychologist or something else. And it just goes to show we all try to just fit people into our own perception and use the labels that we're familiar with.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.